thank you for joining us. We got 4 screens of people so far. That means there are a lot of us, which is amazing. So my name is Yona, and I'm one of the folks from the Central Brain Health IDD team. And this is our second community of practice meeting. So great to see people. If you want, you can say hello in the chat. You can say your name or where you're from. And we're going to have a really wonderful presentation today. And today we get to learn about another program that was developed in the UK, which we think is really important and might be something that we can all use in our own situations. 3 things we're going to do today. We're going to be hearing from Becky, Anderson-Kittow, and Richard Keagan-Bull, our 2 guests from the UK. Then we're going to go into breakout rooms to talk a little bit about what we learned. And then we'll have some time for some questions and answers with our guests from the UK. And I think it'll be fun. So without further ado, I love this picture. Over to you. And we are excited to learn about you and about getting older and planning ahead.
Great. Hi, everyone. Thanks so much for coming. It's amazing to see so many people online.
Yes, hello there.
Richard, you want to introduce yourself first?
Hello, my name's Richard, and I have a learning disability, and I work at Kingston University here in England, London, and I get paid for my job. So I'm a proper member of the team, and I get paid for the work, the research I do with the professor and with Becky as well. Yes, who I work with. Yes.
Yeah, I'm Becky. I'm a researcher in the team with Richard, and we've both been working at Kingston University for just over 4 years.
Yeah, I think it's no, 4 years, 4.5, I think. Yes.
And this is the first project we did together, so we were trying to remind ourselves what we actually did.
Yes.
And just to say, we're going to try and remember to say intellectual disability during this talk, but we might slip into learning disability because that's what we say in the UK. But it's it's the same thing. So I think we will just share our screen now to share some slides. Oh, actually, Richard, first of all, do you want to show everyone what we're going to be talking about today?
We're going to be talking about these. These are the cards that we designed in the planning ahead cards. These are so there's a lot of cards in here, and as you'll see as we go along, we designed these cards. Yes.
So I'm just going to share our screen. So we've got a few slides and some videos and things to show you. So just bear with me. Oh, I need to. Oh, I am sharing sound. Great. Me and Richard started off on working together on Zoom together because it was during COVID. So we became real pros, and now I feel like I've forgotten about it already. So yeah, hopefully you can see it. Can everyone see that okay? Great. And just to say, if anyone wants to chip in at any point, do feel free. Just shout out because we won't be able to see the chat or anything, or if someone else notices there's something in the chat, yeah, just let us know. So like Richard said, we're going to be talking about the planning ahead cards that we made as part of the Growing Older Planning Ahead study, which was part of a big study looking at trying to help people with intellectual disabilities and their families to plan for the future. A lot of the time thinking about sort of where they might want to live as they get older and as their parents get older, and when living at home might not be the best option anymore. So we're going to talk a little bit about how we made the cards and then sort of show you the cards and show you how they're meant to be used. So there were 3 steps in this project. So we started off with interviews and focus groups, so talking to people with intellectual disabilities who are over the age of 40 and their parents and their brothers and sisters. We then worked together with a group of people with intellectual disabilities and family members to try and come up with something to help people with planning. We didn't know at that point what it was going to be. We sort of were trying to work that out together. And then we tested it out with a small group of people. So just to say, first of all, this was your first job as a research
It
assistant,
was,
wasn't it,
yeah,
Richard?
it was.
And whereas this team has over the years worked with a lot of people with intellectual disabilities, sort of working as research assistants, Richard was the first person to be sort of officially employed as a research assistant. And this is a picture of Richard's first day in the office with his name next to the professor's name on the door.
Yes, that's it.
I'm sure this group will already be well aware of why that's important, but do you want to explain a bit about what that brings to the project and why it's important to employ people with intellectual disabilities?
Yeah, well, why it's important to employ people with learning disabilities, because the way I see it, if you're going to talk about people with learning intellectual disabilities, that it's good to have them involved, and not just good to have them involved, but give them a proper job and get them to be paid for. Because at the end of the day, we're the ones who got the intellectual disability, learning disability, so we know about it. So why not use it? Why not ask help to talk about it?
Exactly. So we'll start by talking a little bit about sort of the interviews and focus groups, partly because sort of that fed into how we made the cards, but also it might give you some ideas as well about different ways to talk about the future as well. So with the families and so the parents and the brothers and sisters, it was fairly sort of straightforward, traditional interviews that we talked online to people, and we also had some focus groups asking them about, what they think about planning for the future, what they might want, what they're scared of, what the challenges are. But when it came to talking with people with intellectual disabilities, we took a few different approaches. So first of all, we used books beyond words. Is there anyone on the call who knows anything about, has used books beyond words or has heard of them before? Just, as I say, shout out because we won't be able to hear.
So we actually taught about books beyond words in our courses that people learned about. We think they're really wonderful. But we don't necessarily have all of them, everyone here, but I think we did talk about how helpful it can be to have some of these books because there are no words in them, but just wonderful illustrations.
Yeah.
Brilliant. And just for anyone who might not have heard of them, Richard, do you want to explain a bit about what books beyond words is?
What books beyond words are that they tell a story about that like getting older, like bowel cancer, and all. They're about subjects. They are what affects people with intellectual disabilities or anybody really like this. But it tells a story without words, but with pictures, so people can understand a bit more by looking at the picture and putting the story to the picture. So yeah. So like they're all different kinds of stories, but that was what they are because it's an easy way to help to explain about the subject what is going to be going on. So like if someone's going to go to hospital, in fact, you can get one of these books and just open the pictures, and the pictures will help to explain the story.
Exactly, yeah.
Yeah.
So we used this story that was about a man who was living with his parents and was thinking about maybe moving out. And we used that in our focus groups to help people. We sort of told the story together as a group, and it was to help people sort of give their own ideas about what they might like and what they think about sort of the idea of moving out. So what was the first question that we asked?
Well, we've got people to name the person who's been pointed to, but we've got people in the group to give him a name, like, and that, so that, so the people in the group, the way they took part in it by naming the person who we're talking about. So like you can call him anything, you could call him James or John or whatever, but yeah.
So does anyone in this group have an idea for what we should call him? I'll try and keep an eye on the chat or just shout it out.
Chris,
brilliant. Okay, so this is Chris.
Yes.
He's on a walk here. He's 42 years old. He's on a walk here out with his parents and some family friends. So it looks like Chris is thinking about moving out. Does anyone know who might be the people in this picture? Do you have any thoughts, Richard?
Oh,
Oh wait, I
oh,
was just going to see something in the chat.
yeah,
before
Mum
we,
and a carried.
yeah,
yeah,
that's it. And it might be sort of there might be slightly different professions. Yeah, social worker, we thought maybe.
yeah,
Yeah, someone who would be
Yeah.
able to help him with
Yeah.
moving out. Can you remember what other questions we asked people with this picture?
in fact, we just asked them what they were looking at, and and what they were thinking about, yes, and what kind of place Chris would like to go to, I think. Yes, sorry.
Yeah, and we also asked why he might be wanting to move out. So don't know if anyone has any ideas about why Chris might be thinking about moving out.
Wants to be more independent.
Yeah, that was definitely what a lot of people in
Yes.
our group said, wasn't it? And yeah, we've got loads of stuff here. Right, so
Yeah.
lots of people saying independence, live with friends, start dating.
It's-
Yeah, that was one
Yes, yeah.
people brought up, wasn't it? Be with
Yeah.
friends. Want to be like a sibling. Yeah, that's a really good point. And then another thing we asked them was what questions he might have.
Yes.
So does anyone have any thoughts on what questions he might be asking?
Where can I live?
Where can I live? Yep, that's a big one, isn't it? It might not have a straightforward answer.
Yeah.
Can he visit his mum? Brilliant, yeah.
What can I
Community
afford?
supports. What can I afford? Yeah, that's Who can I live with?
Who's doing my laundry and who's buying my groceries?
Yeah, really good point.
Yeah.
Will I have my own room?
Mm.
Brilliant. Yeah, so you guys are all coming up with the same sorts of things as the people in our group, and we would then say, are these the sorts of questions that you might have? And that sort of just opened it up to sort of talk a bit about people's own thoughts and their own experiences, because we also were talking to some people, weren't we, where they had moved out before and then
Yes,
things hadn't worked out, and so
ended up moving back in with their mum and dad, yes, or mum, yes.
yeah.
So we had quite a mixed reaction to it, because a lot of people were actually scared about, the families was scared because, as we like to call it, the system here, but once you start to do this talk, that you get into the hands of because you do need to get funded and all that. You need social services to help to be able to do that. In fact, and a lot of it's down to in fact, how much you can manage on your own. In fact, if it's going to be cheaper for you to live independently, or if you used to go into a home or somewhere. So a lot of those questions were all in families and also people with a learning disability. In fact, there's one person in our group with a learning disability who likes staying up till quite late or going out, and he was worried that if he lived in a home that he would have to be in bed by 9:30, which does sadly happen sometimes here, that people go, but so things like that, that
Yeah, and that's a really good point, because we had, a lot of people, in the focus groups and in this group have talked about independence, the independence you can get from moving out, but also, there were people worried that they would lose their independence if they're living sort of somewhere a bit more institutional. So it just helped people to talk about it, and it meant we weren't necessarily talking about them specifically to begin with. We were talking about, what was it, Chris? So should we have a look at another way that we talk to people? So we use something called talking mats, which is a series of pictures that people can use to sort of answer questions, and we'll sort of demonstrate it in a bit. You usually have a mat in front of you in person, and you pick up one card at a time, and the person you're speaking to gets to place it down themselves. Unfortunately, it was early 2021 when we were doing this. So it was
Yes.
all online, so we had to be
Yeah.
a little bit creative. So we'll show you. Oops, gone back
Yeah.
one. How we did this.
Yes.
So we used PowerPoint
Yes.
and sort of tried to recreate it. So
Yeah.
for this one, we had people could hold up signs as well to show how important it would be. So maybe me and you can just sort of show people how
Okay,
we
yeah.
did this one.
Okay.
So we would say that we've got a few different things about the place you might want to live, and you need to tell us whether each one of these things is not important, quite important, or very important to you. So Richard, in your home, how important is your bedroom and what your bedroom's like to you?
That's very important.
So I put that there. And for some people that was enough. That was all we talked about. But
Yeah.
for people who had more to say, we
Yeah.
would ask a few more questions. So what would be important about your bedroom?
Well, to have a nice room and to have a bit of space from other people, just have a bit of room for myself, just to be on my own, for my own private room, yes, because, for some people, no, I just want to be on my own a bit, yes.
Yeah. And that's something people worry about a lot, isn't it?
Yeah,
If they
yeah.
move, just sort of losing that privacy.
Yes, that's it, yes.
And we'll maybe just do one more. So what about the local area? How important would the area be that you live in? Not important, quite important.
Well,
or
that would be very,
important?
very important, because you need to get on with people around you, and you need to be able to feel happy, you do, yes.
And what sort of place do you think, what sort of area do you think you'd like to live in? Sort of the city or the countryside or the seaside?
Or, but probably a bit country seaside,
Yeah.
not in the city too much. But well, I mean, we are in the city here, but no, probably in the country a bit more, yes.
And would there need to be certain things nearby in that area?
Yeah, well, probably a nice seaside area, yeah, so you can just go for nice walks, yes, and would be nice to have a flat where you could have a dog or a cat, for something just to keep you company, because if you're on your own, a pet is good to have, to be able to talk to and to cuddle up to, and yeah.
Sounds lovely.
Thank you.
So yeah, we had quite a few of these, and we would then sort of move on to sort of, again, sometimes more challenging things, like what are the things that would worry you about living on your own, or what things would excite you, and so we'd sort of get a bit deeper as we went along. So yeah, that's just sort of a quick whistle-stop tour of those. So what's happening in this picture, Richard?
Well, first of all, the people in this picture, we have the lady in the pretty dress. That's our boss, the Professor Irena. And then there's me and Becky, and there's a lady called Jo Charles, who supports me to do the work what I do with Becky and Irena. And this is like I thought of it before the meeting. It's a day with a data analysis, yeah. Well,
It was analysis, but don't worry about the
Yes,
word. Just
okay.
you explain what we did.
Okay, thank you, Becky. Yes, that because it's quite late here in England. But anyway, what we did is we got all our research and we put it all together, and we put it on sticky, so the day of where we just looked at all the data what we got, and we put it on sticky notes. We did to start with, and then we put all these different big boards up, and we put our sticky notes onto the paper where we thought that would be the right place for it to go. So, and from that we started to think about the cards what we end up making. But this was like halfway through after we'd done our focus groups, you know, I've met people that we got to this stage, and that and also that I don't know if you have this in Canada, but we had Colin the caterpillar there. It's a cake. It is what you buy it in Marks Spencer's here. Anyway, but what I'm trying to say is he was there at the start of the meeting, but he had to leave halfway through because he got eaten. He did, yes, yes.
The national hero, isn't
Yeah,
it?
it is in England, yes.
Yeah, so we wrote down all of the important things, didn't we? And then we tried to group it into well, what we would call them themes, didn't we?
Yes, that's it, yes.
Richard, do you want to explain a bit about what our co-design group was?
Well, our co-design group was basically people with intellectual disabilities and family and carers working together with two groups together. And for our first original plan was that I would talk to the people with intellectual disabilities and that Becky would talk to family and carers. But we just decided that the groups just wanted to work together. So we did a proper co-design. We actually all worked together. We did, yes.
Yeah, and we're working together to try and come up with something to help people to sort of think and plan for the future. But yeah, as I say, we went into it not quite knowing what we were going to do. So we sort of looked at a load of different options, and we also had some guest speakers. So we had, who did we have? Social workers.
Yeah, social workers. We had
people sort of from different sorts of
Yeah.
places you might want to live.
yeah, that's it. We've got this shared life here in England where people with intellectual disabilities live with someone who just share life together. They do really, yes.
And then we also had someone from an organisation who does a lot of sort of planning, sort of one-to-one planning with individuals, so that we could try and capture a little bit of what they did as well.
Yeah.
So in the end, we decided to make some cards to help sort of people think about the future. So we started off with these sort of easy read pictures. We sort of mocked them up quite basic on Word. But people decided that they didn't really like the easy read pictures. They wanted something that was made especially for this, so that it sort of was really showing what they wanted to capture. So we got an illustrator in to come and draw some pictures for us. So this was an example of ones from a pack about what help you might need if you lived somewhere else. So these are sort of a few different drawings that they suggest that the illustrator suggested, so we talked through them as a group to decide which one would look best. They decided to go with black and white so that people could print it at home. And we ended up with something that looked a bit like this. So it was a big picture on the front with a label, and then some prompts on the back, because people wanted some ideas about what they might want to talk about. And this was particularly important for this set that was about what help you might need, because people were hoping to get some help basically to have these conversations with social workers to make sure that they can get the right help in place. But there was a bit of a feeling that this was kind of, you had to jump through a lot of hoops and you had to really persuade people about the help you needed, particularly, you know, if it was going to cost a lot of money. So some real prompts to really help people think about what help they might need and to help explain what would happen if they didn't get that help. And we also made a booklet so that people could write down any thoughts they had after using the cards. And all of our co-design stuff was online, but we did get to have a celebration at the end. So these are a few people from our co-design group at our celebration event, and a few more people in this picture. So just to say thank you to that group. So we have these lovely printed out cards, but to make sure more people could access it, we've got an online version too. So I'm just going to click here and hopefully that will take us to the online version. So it has a video about how to use the online version, because that can be a bit confusing. And it also has a video about the cards themselves and how to use them. And we're going to play that for you now, because I think that's probably the best way to explain the cards to you.
My name is Keagan-Bull, and I'm a research assistant at Kingston University.
Hi, my name's Becky and I work with Richard at Kingston University.
We're going to see how to use these planning ahead cards.
These cards are to help you to think about and talk about the future. They might help you to talk about what's important to your loved one and what help they might need to be happy and safe now and in the future. There are 7 sets of cards. These are things I like to do, things I might need help with, home, what's important, people in my life, about me, mum and dad getting ill or dying, and information cards.
There are lots of cards, but you only need to look at the ones that are relevant to you and your family. You might find that you come back to some of the other set of cards as your needs and circumstances change in the future.
You can use the cards in whatever way you find most helpful, but we'll give you some ideas about how you might want to use them. You can use them in any situation that you prefer. Some people will find it helpful to put time aside and have a focused conversation without any distractions. Other people might want to do it in other situations where they're more comfortable, like at the dinner table or on the bus. If you like to do things on the computer, you can use the online versions instead. Some parents have told us that the cards are useful to look at on their own or with another family member if their son or daughter cannot or doesn't want to use them. Others have said that using the cards with a social worker, support team, or other professionals would be helpful. There is an ideas and tips card in some of the topic sets to give you ideas about how to put plans into action. The information cards also give you some key facts and advice, as well as links to places with more detailed information.
Picking a card to look at.
There might be something specific you want to talk about with your family member. Otherwise, you could start by picking one of the sets of cards. You might pick by colour or what you want to talk about. Then pick a card. You could pick one at random and decide if it's something you want to talk about, or you could spread them all out and pick one you like the look of. You might choose by picture or by reading it out. You might want to pick a few you want to talk about, or just look at one at a time.
Talking about the card, you might want to start by looking at the picture on the front. You could talk about why you chose the card or about what's happening in the picture. You might have things you want to talk about, but there are also prompts on the back to give you ideas of things you might not have thought of.
There are lots of questions on the back of the cards. These were designed for parents to look at to give ideas about things to think and talk about. If they're a bit too detailed, then there is a card for each topic set with simple questions to use for all of the cards in that set. These might be helpful if you have a learning disability and are looking at the cards on your own.
Writing down what you talked about.
You might find it helpful to write down what you've talked about so you remember it and can feel prepared if you talk to someone like a social worker about making plans. You could do this as you use the cards, or you could wait until afterwards. We have given you a Me and My Plans booklet to do this, but if you prefer, you can use something else. There might be other planning guides you like, so you could use the cards with these. Or you could write it down on post-it notes or pieces of paper. You can stick these to the cards or in the booklet, or even put them in a jar. And if you think of stuff when you're not using the cards, you can do this too. You could write on the cards themselves. Do whatever you find most useful.
And for what's in this film, we hope you find the cards useful and for in the future for making decisions. Bye.
Okay, so we'll just have a quick look at what else is on this website? So we've got the list of, oh, that's
Oh,
Richard
sorry.
House phone
Oh,
ringing.
so,
We're in Richard's living room doing this talk, so oh, okay. You get that. I'll hold the phone.
hello. Yes.
So yeah, so this is the list of all the different cards. So let's have a look at this home one. So it's got a few funny bits. So we've got, so this is a bit of an explanation of the home cards. So this one says, these cards can be used to talk about what is good or not so good about your home now. They can be used to think about what will be important if you live somewhere else. There might be things you want to change about your home. There might be things you have to change about your home. Think about which are the most important things. Think about why these are important to you. These cards have some examples to help you think about why some things might be important to you. So they were designed mostly, real good. Okay. Yeah, with sort of families in mind, with the idea that families would sit down together and look at these, or also some parents might just look at them on their own as well, as might some people with intellectual disabilities. So we then can have a look at the different cards. All good?
Yes.
Yeah.
Right.
So you can have a look through the different ones that are here. So maybe me and Richard can have a quick look at one of them together.
Mm.
So, oh no, I picked the wrong one. Living with other people. So Richard, you live on your own at the moment, but
Yeah.
you have thought before about living with other people, haven't
I
you?
have, yes.
So we might have a look at this card, pretending that you're thinking about
Yes.
starting to live with other people. So
Yeah.
why would it be important, and what could be good about living with other people?
Well, it'd be nice to live with other people because then that you're not so on your own and that you get to see other people and that you have someone just to talk to and that but it's nice to be able to maybe live with other people but also to have your own bedroom, you know, where you can just go and just be on your own for a bit. Yes.
Yeah. And are there any reasons you might not want to live with other people?
Well, for you might want to not live with other people because you just might want to be a bit more independent, live on your own and have your own flat, and that maybe have someone coming to see you once or twice a week just to make sure that you're okay, you know, that that's it. Yeah.
And if you did decide to live with someone else, do you know who you might want to live with?
Or it could be a lady, man, you know, that you know that could be either, you know, that oh my Lord. Sorry, sorry, I forgot to turn the phone off. So, I'm sorry. The fact living with other people is good because you have company, and that you can also have a telephone and your mum can phone you halfway through the call. Yes,
It's a good insight into our first few months of
yes,
working together
yes.
on Zoom completely, wasn't it?
Yeah, it was. Yes,
Yeah.
yes, yeah. No, but
And do you think you'd want to live with just one other person or a group of other people?
well, maybe just one other person because sometimes it can get a bit crowded. It can be. Sometimes it's good just to be with maybe just to somebody else who can maybe just have some time together, maybe share meals together, and you know that they can do their thing, you can do your thing. Yes,
Right.
yes.
So yeah, it's just a little snippet of how a conversation with the card might go. I think, you know, you might well just look at the picture and not worry about the questions on the back. But for some people, they really wanted a bit of help to sort of guide those conversations, particularly, you know, if people have never thought about this before, it's helpful to have some prompts there. So how are we doing for time? We won't take too much longer, I don't think. So we'll very quickly talk about testing them out. So we've got a few families, didn't we, to test them out. We ended up spending more time designing them than testing them in the end because we thought it was really important to get things right to make sure they the cards were how the group wanted them to be. Yeah. But on the whole, people did seem to like the cards. So there was a group of people, not unlike this one actually, of people with intellectual disabilities who are sort of older and thinking about the future and get together you know, once every month or two. So we sent them to that group for them to have a look at, as well as some families. So they said they're good for helping you to think about things. They led to lots of talking about why people would like to live in the country or not, pets, gardens, rules that people used to have to follow. This was a parent who said, it made me think about how my son would see it from his eyes. It helped me to think about what he would like and what is available. Helped think of questions I want to ask. But some people thought that there were too many words on there. So some people really liked those prompts because it helped them to think about things that they really wouldn't have come to mind. But some people just thought it was a bit intimidating, I think, having so many words on there. So we came up with these quick questions that you might have seen in the video, of just sort of 3 short questions for each set of cards that might help guide the conversation without having all those long questions. And it was part of the reason we had the questions on the back of the cards.
Just going to send my mum a message on.
Go for it.
Yeah.
So yeah, so that you could look at the picture without needing to worry about the words at all. So yeah, thank you all for listening. Thank you to our sort of brilliant co-design group, and also to the other members of the team who you saw in that picture early on. So yeah, Jo Giles, who supports Richard but does a whole lot more within our team, and Irena Tafrivena, who leads the project. And then we're just going to do a bit of self-promotion for Richard, but he's usually very good at doing himself. He's just
Yes,
checking in with his mum.
yeah,
Which is what happens when you live on your own. You've got to check in.
yeah. Well, we've got my book out. Which is on Amazon. You can buy it on Amazon, so you can buy international. You can, yes, but and then there's my podcast, which I actually talked to. Yona, I did. So you can listen to that, and you can hear me talking to Yoni. You can in Chicago, yes. That so it's all out there for you to find out about. Yes, yes.
I don't know if we were able to reveal who your special guest was today that you interviewed, or if that's a
I know.
secret for now.
I would put off to 8:30. Who I spoke to today is that this was. I spoke to a celebrity in England today, and it's the first time I've spoken to a celebrity on my podcast. Well, when I say celebrity, someone who's quite big on television here in England, and it's a lady who did the forward for my book, Mel Gedridge. I don't know if you heard of her in Canada, but you may have not. But
Have you seen the early Great British Bake Off?
yes, yes.
It's Mel of Mel and Sue. So
Yeah, that's it.
there's
Yes.
space for that to come out. But obviously, you know, the podcast with the owner is probably the best one.
Yes, yeah, that's it. Yeah, of course. Yeah. No, but, no, you must listen to that one.
They're all great, all the podcasts, Richard. I think
But
probably-
honestly, today for the podcast today, that could probably get quite well. She could probably bring a lot of the listeners into it. She could, because it's quite a big name here in England. She is, but she's really quite down to earth. She was, yes.
Sounds awesome.
Yes.
So thanks for plugging the new book and the podcast. Thank you for sharing the cards. They're fantastic. There's so many comments. I know while you were talking, you probably couldn't read them, but a lot of people were talking about how good these cards can be as conversation starters, especially when maybe people are not feeling like they're ready to talk about certain things. It's kind of a nice way to introduce it and almost have your own control over what you choose to talk about, right? So this is what's going to happen next, everyone. We are magically going to go into 3 different breakout rooms. We're going to put the link in when we go into the breakout rooms to the cards, and we'll share them with everyone after as well online. And we're going to just talk a little bit about them in our groups. And the specific things that we will talk about, I think, is really thinking about, you know, if there's any questions we have for Becky and for Richard, or anything we want to just, you know, say, or what we think about the cards, just to get more familiar with them and how we could see using them in our own practice. So I think, is it Tiz or Prachi who's going to give us our breakout instructions? We'll come back after the breakouts to the big group, and we'll sort of share some of our bigger questions. And Becky and Richard are going to pop into our different groups also and chat with us in the next little bit. So we had some really rich discussions. We have a tiny bit of time. If there's maybe one question or thought from each of the 3 groups, and then we're going to wrap up with a few more comments. But just to say that these cards can be available and can be printed. And we'll also look at ways we can, we'll share information with everyone on accessibility. And also someone I know in our group wondered about, you know, can we share this with other people? Is that okay? 100%. The whole purpose of this, I think, is for sharing. So this is,
Yes.
yeah.
Spread the word.
So I wonder from the first group, Nicole, was there any questions or like one comment or thought that they came from your group that you wanted to share back?
Well, I certainly think our group had an amazing conversation and some great ideas around kind of sharing this knowledge out and who needs to know this and how can we even try it. So wondering about a course or bring people who are interested in kind of practicing about what these tools might be like, and sharing it with even the Developmental Service Agency in Ontario around planning. I think even just taking these and seeing how we can knock on some doors and get people to use it from an accessibility perspective. So I think that's a part of what we talked about today.
Brilliant.
Thanks, Nicole. How about Mary from the family group? Any comment or question?
I think it's overwhelmingly positive and excitement, actually, you know, from our group. And in terms of the design, first of all, and it's very simple and thoughtful, and the graphic is, you know, like Janine was saying, very, you know, kind of useful in terms of helping represent, you know, like what the topic is about, and there is a lot of utility to the cards in terms of helping with the communication and also helping even, you know, like if it's not communicating or with the family member, it's sometimes it's good to use these cards. Caregivers can also use these cards to organize their thoughts as well, and making it less overwhelming as well. So, and yeah, it's thank you so much.
Thanks, Mary. And Anupam, anything from the last group?
Yeah, I think in our group we thought it's really very useful as a conversation starter, as a facilitator of different types of conversations, and the structure of the cards were also found to be really very interesting, very helpful, especially with notes, so that you can it's not only the pictures, but it also has got certain directions if you want to have certain types of conversations. And I think we also discussed about how important it will be to share the information, share the cards. And I suppose you may be sharing more information about that, about how to share and what will be happening.
Thanks. So it sounds like a lot of enthusiasm across all of the groups, and a lot of interest, I think, in what you presented on today. I wonder if you want to have the last words, looking to our guests from across the pond, if there's anything you've observed or listened to that you thought was interesting, hearing from people in Canada, or if there's anything you want to say before we wrap up. I'm going to have a few comments to say right at the end, but I can turn it over. Maybe Richard, you have some thoughts?
In fact, do I have some thoughts? Well, in fact, thank you for listening to us. In fact, I hope that you can find the cards helpful, and yeah, no, just thank you for listening to us. I think, and but please don't worry, because there is help out there, and that these cards would be to help to lead to the help out there. Yes.
And yeah, it was. I feel a lot more enthusiastic
Yeah.
now just after the meeting. It's so nice to hear
Yes,
something
yes.
from them, and it's just really interesting as well, and not too surprising, I guess, that all the same issues come up in Canada as they do over here. That there might be some small differences in the way the system works, but we're hearing a lot of the same things. So hopefully that means that the cards will be useful for people in Canada as well. So I really look forward to hearing about if anyone ends up using them.
Yeah.
Thank you. And I think we have to take that message as well to heart, please don't wait. And what was in that video when the mom spoke right at the beginning, she says, when do we need these now? Right? So These are conversations never too early. We always talk about in brain health, it's never too early for us to be thinking about our brain health. It's also never too early to be having conversations about changes that happen in our lives as we get older. And it really is okay. I think for us to remember, like even the card set in the family group, we looked at the card set around if mom or dad is sick or is dying. And that's a hard topic, but I know it's a big topic that people have really spoken about in the different groups. And for us to remember that when you met with lots of people who had, with learning disability, with intellectual disabilities, these were cards they wanted people to talk about, right? Like the words on those cards and those ideas are things that people think are important, even if they're hard. So it's never too early, and we should try not to be afraid of trying to have some organized conversations around these things. So thank you so much for sharing the resources. We will do our homework offline after to think about how we can make them most accessible to folks here in Canada and spread the word. It does say here, please remind us of the name of the project that's looking at illness and end of life. So there's so many amazing projects I know that you're involved in, and some of them are sort of coming to the ending, some of them are just starting. We could share links to all of them with our community of practice. If you give them to us, that would be great.
Yeah, great.
Lots of nice thank yous here. So I'm just going to do a few wrap-up items for our community of practice. We're very grateful to you for helping us learn together about brain health and why it matters so much in our community. So thank you for being part of our amazing program. And please give us your feedback after today. And we'll be in touch with everybody soon. So